Hello everyone, this video is about human anatomy. It is a new series about human anatomy where I will discuss about some general topic about the human anatomy, and it is a part 1 of this series. And today's topic is about terminology and general plan of the body. If you like this video, please like, comment and subscribe my channel and also share it with your friend. So let's start. First, there is some general points about the anatomy, and then there is some comparison about anatomy and physiology. So let's start. First of all, what is the definition of anatomy? Anatomy is a branches of the biology concerned with the study of the structure of an organism and their parts. Or, anatomy is a scientific study of a structure or an organism of an living organism including cells, tissues or organs at both microscopy and macroscopy. It is also described what the body is made of and where those parts are. So what is anatomy? Anatomy is a branches of the biology that is mainly focused on the structure of an organism and their parts, or the scientific study of structure organization of the living organism including cells, tissues, organs in both level macroscopy and microscopy. Microscopy means when we discuss about any cells, tissues or organs under the microscope, and macroscopy means where we discuss about any organs, tissues or cells with our naked eyes. And after anatomical study of an organism, we can describe what the body is made of and where those parts are. Then the word anatomy is derived from the Greek word anatomy. Here there is a my and there is a me, means to cut up, where ana means up and tomy means cutting. Then who is the father of anatomy? Most of the people say Andreas Vesalius is the father of modern anatomy. For revolutionizing the field during resilience through his detailed anatomical illusion and empirical approach. But the Greek physician Herophilus is sometimes considered the father of anatomy as he was the first to perform the systemic anatomical human dissection, leading to scientific discovery about the brain, eyes, and our nervous system. Then the focus of anatomy. The main focus of human anatomy is about the physical form and the arrangement of body parts from macroscopic structure like organs and bones to the microscopic component like cells, tissues. Then the example of anatomy. First, gross anatomy. It is the study about the visible body parts. Then histology. It is the study of the tissue at the microscopy level. Then cytology. It is the study about cell. Then please note that human anatomy is also known as anthropotomy. Then there is a short details about the physiology. First of all, definition of physiology. Physiology is the study of how anatomical structure and the parts are function. It explains how and why they work to support life. So physiology is a scientific study that discusses about the how anatomical structure are works on our body, or it explains how and why they work to support our life. Then the focus of physiology. The main focus of the physiology is about the study of chemicals and the physical process that occurs within the body structure to keep alive and the functioning. For example, circulatory system physiology, nervous system physiology, homeostasis. In the circulatory system physiology, it describes how the heart pumps the blood to deliver oxygen and nutrition, and in our nervous system, it describes how nerve impulse to transmit information. Homeostasis. It is the body's ability to maintain stable internal condition despite external changes. There is some physical and chemical process to maintain our homeostasis in our body. I already discussed about the homeostasis in a video. If you want to know, please visit my channel and watch this video. Then there is some classification about anatomy. First, gross anatomy, or it is sometimes called macroscopic anatomy. And then the second is microscopic anatomy or histology. First, gross anatomy. It is defined as the study of the body structure that can be seen with the naked eyes, often through dissection. It helps to obtain complete information about structural organization of an organism. So what is gross anatomy? Gross anatomy is a part of the anatomy that discusses about those organs that we can see with our naked eyes or sometimes after dissection, or it helps to complete information about any structural organization of an organism. For example, all internal and external organs of an individual. Systemic anatomy and the regional anatomy is a part of the gross anatomy. So, first of all, in the systemic anatomy, it is mainly focused on the study of a specific organ system. For example, digestive system, nervous system, circulatory system. So, in the part of the anatomy where we discuss about any of the system, it is called systemic anatomy. Then, regional anatomy. It is the study of specific region or areas of the body. For example, head, chest, limb, those are included in regional anatomy. So the part of the anatomy where we discuss about a specific region or any areas of the body part, it is called the regional anatomy. So gross anatomy we can divide it two parts, systemic anatomy and regional anatomy. Where we discuss about any system is called the systemic anatomy, and regional anatomy where we discuss about any specific region or areas of the body, it is called the regional anatomy. And the second types of the anatomy is microscopic anatomy. It is also called histology. It is defined as the study of the microscopic structure of a tissue or the cells, which is the smallest part of an organism. So in the histology or microscopic anatomy, it is discussed about any tissue or the cells that we can observe under microscope. Then the individual who specialize in histology are called histologists. It is also useful to examine or compare different types of microorganisms and their structure. For example, different types of WBC like neutrophil, basophil, eosinophil, monocyte, lymphocyte, and tissues of the body. Then, histology and cytology is a part of the microscopic anatomy. In the histology, where we discuss about the tissue, histo means tissue, and cytology, where we discuss about the cells, cyto means cell. So, in the microscopic study, there is two parts, histology and cytology. In the histology, where we discuss about the tissue, and in the cytology, where we discuss about the cells. Then there is some importance of anatomy. First, medical professional. Second, diagnostic illness. And third, comparative anatomy. First, medical professionals. All medical professionals must have comprehensive anatomical knowledge to perform procedure successfully. Any of the procedure that he or she is performed in our body. So, the appropriate anatomical structure and position is should known to perform any of the procedure, for example any of the test or any of the surgery successfully. Then the diagnostic illness. Properly knowing the anatomical structure of the body is essential for identifying any abnormality that is caused by any disease. Then comparative anatomy, the comparison of a structure of different species that helps the scientist to understand adaptive evolutionary changes. So these 3 points are mainly the importance of anatomy. Then anatomical terminology. Anatomical terminology provide a standard language for describing human body and its structure. It allows people to clear communicate effectively and accurately. Then anatomical position. It is an important definition in our anatomy. The body of a person is in standing upright position with the head facing forward and both arms at the side with the palms of the hand facing forward and slightly away from the trunk. The feet are together and parallel. This position is called anatomical position. There the trunk means the human body. This position helps to ensure the accuracy and consistency of all anatomical description. So, what is anatomical position? Anatomical position is the position of the human body when he or she standing upright position with the head facing forward and both arms are at the side with the palm of the hands facing forward and slightly away from the trunk, and the feet are together and parallel. If in a position all the conditions are fulfilled, this specific position is called anatomical position. Here same the condition of anatomical position, standing upright position. You see in this picture there is a person who is standing upright position, the head facing forward, both arms are sided with the palm of the hands facing forwards and slightly away from the trunk. The feet are together and parallel. You see that in this picture all other condition is fulfilled. So this specific position is called anatomical position. Then there is a terms used to describe trunk or the human body. First, directional terminology. Anterior or ventral, posterior or dorsal, superior or cranial, inferior or caudal, medial, lateral, intermediate, superficial or external, intermediate, deep or internal, proximal, distal, unilateral, bilateral, ipsilateral, contralateral, invagination, evagination. So first I discuss what is anterior or ventral position. The front of the trunk or the body of a human is called anterior position. For example, the breastbone is anterior to the spine or the nose is ventral to the ear. You see that this is the breastbone and this is the spine. So you easily understand that the breastbone is present in the front of the spine. So that's why it's called the breastbone is anterior to the spine. Then the nose is ventral or anterior to the ear. You see that this is the nose and this is the ear. So obviously the nose is present in the front. So that's why nose is a ventral or anterior to the ear. Actually, in all of this position which I explained of the body parts are described according to the other body parts of the body. Then the second position is posterior or dorsal. The backside of the trunk or the body of the human is called posterior or the dorsal position of a human body. For example, the heart is posterior to the breastbone or the spine is the dorsal to the chest. You see in this picture that the heart is present behind the breastbone. So that's why it's called that the heart is posterior to the breastbone. Then the spine, you see that this is the spine and this is the chest. So obviously the spine is present behind the chest. So the spine is the dorsal or the posterior to the chest. You see that there is some picture. This is the interior view of a human body, both of this, and this is the posterior view of a human body. Or if you see a person from his side, so this is the front part of the body, so it is the interior part, and this is the back part of the body, so it is called the posterior part. Then superior or cranial position. The organs or the structure of a body towards the head is called the superior position or the cranial position, or close to the upper parts of the body is also called the superior, or positioned above another organ is also called superior. So there is a three definition about the superior or the cranial, where the cranial refers to the head end. For example, the head is a superior to the neck or the neck is the cranial to the chest. You see that there is a head of a human body and this is a neck. So the head is present above the neck. That's why the head is superior to the neck. You see this is the chest. So neck is present above the chest. So the neck is cranial to the chest or superior to the chest. The head is superior or the cranial to the neck. Then the opposite of the superior is inferior. Inferior is also called caudal. Organs of the structure away from the head or the closer to the lower of the body parts is called inferior or caudal, or the position below another organ is called the inferior. So same there is three definition where the caudal means tail end. For example, the feet are inferior to the knees are caudal to the chest. You see that this is the chest and this is the knee. So the knee is present below the chest and this is the feet and this is the knee. So the feet is present below the knee. So the feet are inferior to the knee or caudal to the knees, or the knee is inferior or caudal to the chest. Then the next position is medial. The structure close to the midline of the body is called the medial. For example, the heart is medial to the arm or the nose is the medial to the eye. See, this is the midline of the body that divide a body from two halves. So both arms are present both sides of a human body and in the middle there is the heart. So the heart is more closer to the midline as compared to the arm. So the heart is medial to the arm or the nose is a medial to the eye. So heart and nose both are the more closer to the midline as compared to arms and eyes. So that's why the heart is a medial to the arms or the nose is a medial to the eye. You see in this picture. And then the opposite of the medial is lateral. The structure away from the midline of the body or the structure at the side of the body is called the lateral. For example, the arm is lateral to the chest or the ears are the lateral to the eyes. Both arms and ears are present the side of the body and the eyes and chest are more closer to the midline. So both of the structure, arms and ears, are away from the midline. That's why the arm is lateral to the chest or the ears are lateral to the eyes. Then intermediate. The structure between a more medial or the lateral structure is called the intermediate position. For example, The clavicle, that's also called collarbone, is intermediate between the sternum, is also called the breastbone, and the shoulder. So the clavicle is present between the sternum and shoulder. You see that this is the clavicle and this is the sternum and this is the shoulder. So clavicle is present between the shoulder and sternum. And the second example is the knee is intermediate between the ankle and hips. You see that this is a hips, this is a knee, and this is the ankles. So obviously the knee is present between the hips and ankles. That's why the knee is intermediate between the ankle and hips. You can practice this image and draw in your exam. Then the next concept is superficial or external. The structure or the organ that is closer to the outer surface of the body is called the superficial. For example, the skin is superficial to the muscle. You see that the organ that is present closer to the outer surface of the body is called the superficial, and there is some layers. See in this picture that there is a three layers of a skin: epidermis, dermis, and hypodermis tissue. These all are the three layers of the skin. Then muscle, then bones. So the skin is more superficial than the muscle because bones and muscles are present is inside of the body, and the skin is more superficial according to the muscle and bones. So the skin is superficial to the muscle and bones. Then deep or internal. The opposite of the superficial is deep or internal. The organ of the structure further away from the surface of the body or away from the skin is called the deep, or the organ that is present inside the body is called deep or internal. For example, the bones are deep to the skin, or the heart is deep or the internal to the skin. You see this picture that the bones is present inside the skin, so that's why the bone are deep to the skin, and the heart is present inside the skin. So same, the both bone and heart are deep to the skin. Then intermediate. The structure or the organ that is present between two structures is called intermediate, as same as before. For example, the navel or umbilicus is intermediate to the left arm and contralateral or the right leg. You see that this is the umbilicus and left arm and right arm. So umbilicus present between the left arm and right arm, you see in this picture. Then the next concept is proximal and distal. First, proximal. The organ of the structure toward or near the tongue is called the proximal, or closer to the roof of the limb is also called the proximal. For example, the elbow is proximal to the wrist, or humerus is proximal to the radius. You see in this picture, I try to differentiate both of the example with different color. First example, the elbow is proximal to the wrist. You see that this is the elbow and this is the wrist. So the elbow is more closer to the body as compared to the wrist. That's why the elbow is proximal to the wrist. And then the next example, you see that this bone is called humerus, this bone is radius, and this bone is called the ulna. So humerus is more closer to the body as compared to the radius. That's why the humerus is proximal to the radius. So you also say that the humerus is proximal to the elbow, radius, ulna, or wrist. I think this concept is clear to you. Then distal. It is the opposite of the proximal position. So the organ or the structure that is present further away from the tongue or the body or away from the roof of the lip is also called distal position. For example, the wrist is distal to the elbow, or the knee is the distal to the thigh. You see both of this picture, this is the wrist and this is the elbow. Both of this picture that the wrist is away from the body as compared to the elbow, and the knee is away from the body as compared to the thigh. That's why the wrist and the knee both are the away from the body as compared to the elbow and thigh respectively. So that's why the wrist is a distal to the elbow and the knee is a distal to the thigh. Then the next concept is unilateral and bilateral. The structure on one side of the body is called the unilateral, and the structure that is present both sides of the body is called the bilateral. The example of unilateral is the spleen is the unilateral organ because it is located only the left side of the body. You see in this picture that this is the midline of the body. If I cut parallel to the midline, we found two pieces, a right pieces and a left pieces. And beside the stomach there is present spleen that is present only the left side of the body. So the spleen is a unilateral organ in the body. And then the example of bilateral is the kidney and the both legs are located on the each side of the body. You see in this picture that the kidneys are present in the both side of the body. One is the right side and one is the left side. And the same, the both legs are present. One is the right leg and one is the left leg. So the kidney, both legs, both arms are located on the east side of the body. That's why it's called the bilateral organ of the body. Then the next concept is ipsilateral and contralateral. The organ that is present on the same side of the body as another structure is called the ipsilateral. For example, the left arm and the left leg are ipsilateral. You see in this picture that this is the midline of the body. If I cut parallel to the midline, we found two pieces. One is the right pieces and one is the left pieces. So the left brain, left arms, left legs, both are ipsilateral, and as same the right brain, right legs, right arms, both are the ipsilateral. Then contralateral. The organ or the structure that is present on the opposite side of the body from another structure is called the contralateral. For example, the right arm is controlled by the left hemisphere or the left brain hemisphere. So the right arm are contralateral to the left brain hemisphere. So if the structure of the body is present in the same side is called the ipsilateral. If it is present in opposite side, it is called contralateral. Then the next concept is invagination and evagination. First, invagination. The process where the surface folds inward to form a cavity is called the invagination. For example, the oral epithelium can invaginate to contribute to the tooth formation. You see, this is a picture that is the process of the tooth formation, and in the second picture that the initiation of the invagination. First the early tooth birth and then the initiation of the invagination. So from this step the invagination is started, and there the surface is folded inward and form a cavity. So this process is called the invagination. And you see that last three picture that the cavity is become more deep and deep. Then evagination. The process of the epithelial surface folded outward is called the evagination. For example, the epidermis thickens and pushes into the dermis and forming a cup-shaped structure and then become hair follicle. You see that this is the process of the formation of a hair follicle. In the first picture, epidermal thickening, placode formation. Then in the third picture, there is a evagination started. So in the time of the formation of the hair follicle, the both layer epidermis and dermis are folding outward and helps to the growth of the hair follicle. You see in the fourth picture there is a invagination formation. In the time of the growth of the hair follicle, the epithelial surface started to folded inward and form a invagination. And the epithelial surface folded inward and helps to the growth of the hair follicle. So first of all evagination occurs and then there is a invagination occurs. In the time of the formation of the hair follicle, evagination occurs, and in the growth time there is a invagination occurred, and after that hairs are produced. So there is all of the terms that I described till now. First, anterior, the organs that is present in the front of the body is called the anterior. Then posterior, the organ that is present in the back side of the body is called the posterior or the dorsal. Then superior, the structure that is present towards the head or the upper part of the body is called the superior, while the cranial means the head end. Then there is the inferior, the organs of the structure that is present away from the head or closer to the lower part of the body is called the inferior, where the caudal refers to the tail end. Then the medial, the structure that is more closer to the midline of the body. Midline is the line that is present in the middle of the body. Then the lateral, the structure that is present away from the midline of the body is called the lateral, or the structure present in the both side is called the lateral. Then intermediate, the structure between more medial and lateral structure is called the intermediate. Then superficial, the structure that is closer to the outer surface of the body is called the superficial. Then the deeper, the structure that is the farther away from the surface of the body or away from the skin is called the deep. Then the intermediate that is present between two other structure is called the intermediate. Then proximal, the structure or the organ that is present toward or near the body or more closer to the roof of the limb is called the proximal. And distal, that is present further away from the trunk or the body is called the distal, or the away from the roof of the limb. Then unilateral, the structure that is present on the one side of the body is called the unilateral. And bilateral, the structure that is present in the both side of the body, that is called bilateral. Bi means two and uni means one, and the lateral means side. Then ipsilateral, the organ that is present on the same side of the body is called the ipsilateral. Then contralateral, the organ of the structure that is present on the opposite side of the body from another structure is called the contralateral. Then invagination, the process where the surface are folded inward and form a cavity is called the invagination. And evagination, the process where the epithelial surface are folding outward is called the evagination. So I revised again all of these terms that I described now. Then regional terms. First, there is some terms that I used for anterior body parts. So let's start. Abdominal. Anterior body trunk inferior to ribs. Axial region, head, neck, trunk. Acromial, point of shoulder. Appendicular region, limbs. Antecubital, anterior surface of elbow. Antebrachial, forearms. Carpal, wrist, auxiliary armpit. Brachial, arms, deltoid, curve of shoulder area formed by deltoid muscle. Buccal, cheek areas. Cranial, skull. Cervical, neck region. Frontal, forehead. Inguinal, area where thigh meets body trunk or groin. Coxal, hips. Crural, legs. Dorsal, the back. Fibular, lateral part of legs. Nasal, nose areas. Oral, mouth. Digital or phalangeal, fingers or toes. Femoral, thigh. Orbital, eye areas. Patellar, anterior knee. Pelvic, area overlying pelvis. Pubic, genital area. Sternal, breastbone area. Tarsal, ankle region. Thoracic, chest. Cubital, the elbow region. Umbilical, navel. Then there is some terms that we used for the posterior surface of the body. Carcanial, heel of foot. Femoral, thigh. Gluteal, buttock. Scapular, shoulder blade region. Sural, the posterior surface of the lower leg or the calf. Limbar, area of back between ribs and hips. Occipital, posterior surface of head. Cephalic, head. Olecranal, posterior surface of elbow. Popliteal, posterior knees areas. Sacral, area between hips. Vertebral, area of spine. Plantar, sole of foot. All the regional terms with a proper image I describe in my next video. If you want this video, please subscribe my channel for get the notification first. Then there is mainly 4 terms used in the embryology in gross anatomy. First, cranial or rostral, the structure that is present towards the head. Caudal, the structure that is present towards the tail. Ventral, structure towards the belly. Dorsal, structure towards the back. You see in this picture that the structure towards the head is called the cranial or rostral, and towards the tail is called the caudal, towards the belly is called ventral, and towards the back is called the dorsal. Then there is some terms used for the movement of the body: flexion, extension, abduction, adduction, rotation, medial rotation, lateral rotation, supination, pronation, circumduction, opposition of thumb, reposition of thumb, dorsiflexion of foot, plantar flexion of foot, inversion of foot, eversion of foot, protraction, retraction. Then start with flexion. When two flexor surfaces are brought closer to each other, this movement is called the flexion. For example, elbow joint. When front of the arm and forearm are opposed to each other, you see in the first picture that there is a front of the arm and the forearm that are closer to each other, and this movement is called the flexion. Then in the lower limb, when front of the thigh came in the contact with the front of abdomen. You see in this picture that in the lower limb, when the thigh is came closer to the abdomen, is called the flexion. Then third example, flexion of the knee occurs when back of the thigh and the back of the leg came in opposition. You see in the third picture that there is a back of the thigh and the back of the leg are came closer to each other. So this movement is also called flexion, because flexion is the movement where two organs or the two body parts are came closer to each other. Then fourth example, in neck, when face comes closer to the chest. You see in this picture that the face are came closer to the chest, and this movement is called the flexion. Then the fifth example, in trunk, forward bending of the body or the trunk. You see in the last picture that there is a forward bending of the body. So these all are the example of flexion. In this video, I will give a lot of example and lot of image. So I request you, if you like this video, please like, comment and subscribe my channel, and also share it with your friends. Then lateral flexion, side to side bending motion of the body parts and the body parts away from the midline of the body is called the lateral flexion. It is the most common in neck and spine. For example, when the ear is brought closer to the shoulder. You see in this picture that the movement of the neck where the ear is brought closer to the shoulder. So this movement is called the lateral flexion. And in the second picture, there is a sideward movement is the lateral flexion. You see in the second picture that there is a sideward movement occurs, and this movement is called the lateral flexion. Then extension. When the extensor surface are brought in as much approximately as possible. So when the extensor surface are brought in as much as possible, or if I use the definition of extension, that the opposite movement of the flexion is called the extension. So the example of the extension is strengthen the arms and the forearms at the elbow joints. You see in the first picture when the front of the arm and forearm are away from the body at the elbow joint, and this movement is called the extension. Then the second example, extension of thigh and knee occurs when a person standing erect. So you see in the second picture when a person is in a standing position, so the thigh and knee both are away from the trunk, and this movement is called the extension. There is the extension of thigh occurs. Then extension of knee when a face brought away from the chest. You see in the third image. Then fourth, backward bending of the body. So these all are the example of the extension. All of the red line that I used in this image, this is used for showing the movement of the body parts. I think all of these images are helpful for your better understanding. Then the next concept is abduction and adduction. First, abduction. When the limb or the other parts of the body is taken away from the midline of the body. The example of abduction is the shoulder raises arms out of the side of the body to form a T with the body. You see in the first picture that the shoulder is rises, so the body form a T shape and the both arms are moved away from the midline of the body. Then the second example when the thigh is taken away from the medial plane. You see in the second picture that the legs are away from the body or the midline of the body. So it is the example of the abduction. Then the third example, abduction of the finger occurs when all the fingers are spread away from the midline finger. You see in the third picture that all of the fingers are spread away from the middle fingers. So this is also an example of abduction. The axis of the movement of the finger is the line passing through the center of the middle finger. Then the next concept is adduction. When the limb is brought closer from the body is called the adduction, or the opposite movement of abduction is called the adduction. For example, lowering arms from T position back to the body side. You see in the first picture after the lowerings of the arms, the both arms are closer to the midline of the body. So it's called the movement of adduction. Then the second example is when thigh is brought closer to the medial plane. You see in the second picture that the thigh or the legs are closer to the midline. And the third example is adduction of the fingers occurs when all the fingers are together. You see in this third picture that all the fingers are closer to the each other. So these all are the example of adduction. So when limbs or any other body parts is closer to the midline of the body is called the adduction, and when it is taken away from the midline is called the abduction. Then rotation. What is rotation? It is a type of the body movement where the bone rotates around its own longitudinal axis either towards the midline or away from the midline. For example, rotating head or neck from side to side involves rotation at atlantoaxial joints where the atlas C1 rotates around the axis C2. You see in this picture that the rotation of the head or the neck from the side to side movement where atlas C1 rotate around the axis. Atlas and axis both are the part of the cervical vertebra where there is a 7 cervical vertebra. So first and second part is the atlas and axis. Then the second example is humerus in the shoulder and the femur in the hips can rotate medially or laterally within the ball and socket joint. Then rotation can be divided into two types, medial rotation and lateral rotation. First, medial rotation. It is sometimes called internal rotation. When the rotational movement towards the midline is called the medial rotation. For example, with a straight leg, rotate it to the point of the toe inward is called the medial rotation of the hips. Or when the thigh is turned medially, it is also an example of the medial rotation. You see in this picture that the thigh is turned medially and also toe moves inward. And the second example, when the arms rotate medially, bringing the flexed forearm across the chest. You see in this second picture where the arm rotate medially and the forearm are closer to the chest. So these two are the example of medial rotation. Then lateral rotation. It is also called the external rotation. Rotating movement away from the midline is also called the lateral rotation. Or you can say that the opposite of the medial rotation is also called the lateral rotation. For example, with a straight leg, rotate it to the point that toes outward. It is the example of lateral rotation of hip. Or when the thigh is turned laterally. You see in the first picture when the legs or the thigh is turned laterally or when the toe are moved outward, it is the example of lateral rotation. Second example, when arm rotates laterally taking the flexed arm away from the body. So when our flexed arm are away from the body, it is also an example of lateral rotation. Third example, sideward rotation of the body. So these all are the example of lateral rotation. Then supination and pronation. When the palm is facing forward or upwards or the supine position is called the supination. Then pronation. When the palm facing backward or the downward or prone position is called the pronation. The example of supination is putting food in the mouth, holding bowl of soup. When lying flat on the back, the body is supine. And the example of pronation is picking food with the fingers from the plate, or when lying flat on the front, the body is prone. You see in this picture, when the palm is in the front or the anterior position is called the supine position, and the movement is called the supination, and when the palm is back or posterior position, it is called the prone position, and this process or the movement is called the pronation. Please note, in the supination and pronation, this movement occurs at the radio-ulnar joints where the radius rotates around the ulna. Then circumduction. It is the conical movement of the limb extending from joints at which the movement is controlled. A combination of extension, abduction, adduction and flexion in a sequence is called the circumduction. For example, bowling at the ball and socket joint in the shoulder. Maybe you observed that in the time of the bowling, there is a conical movement occurs on our limb, where there is a limb or our hands extending from the joints, and there is a movement occurs where there is a combination of extension, abduction, adduction and flexion, and this movement is called circumduction. You see in this picture, there is abduction, flexion, extension and adduction, all are the occurs in the time of the bowling at the ball and socket joint in the shoulder. Then the second example is circumduction of the thumb. Then opposition and reposition of thumb. First, opposition of the thumb. When the tip of the thumb touch the tips of the any fingers is called opposition of thumb. And then the reposition of the thumb. When the movement of the thumb and the other fingers away from each other is called the reposition of the thumb. You see in this picture. You see that these all are the example of the opposition of thumb, and this is the example of the reposition of thumb that I try to explain with this image, and I draw this image. You see in this picture that our thumb touches all of the tips of the finger, first, second, third and fourth is the example of the opposition of thumb. And when both thumbs and other finger are away from each other, and then the reposition of the thumbs when both thumbs and other fingers are away from each other are called the reposition of thumb. Then dorsiflexion and plantar flexion of foot. First, dorsiflexion of foot. It refers to the flexion at the ankles. It occurs dorsum of foot is brought closer to the front of the legs and sole faces forward. You see in this picture that the foot is closer to the front of the legs and the sole of the legs are faces forward, and this movement is called the dorsiflexion of foot. Then plantar flexion of foot. It refers extension at the ankle. When sole of the foot or the plantar of the foot faces backward, you see in this picture that the sole of the foot are faces backward. So the foot are far from the front of the legs. This movement is called the plantar flexion of foot. Then inversion and eversion of foot. Inversion of foot occurs when the medial border of the foot is turned towards the midline of the body is called the inversion of the foot. You see in this picture that the inversion of the foot occurs when the foot is turning inward or more closer to the midline of the body. Then eversion of foot. Eversion of foot occurs when the lateral border of the foot is turns away from the midline of the body. You see in this picture that the eversion of the foot occurs when our foot is turning outward. So for this our foot are away from the midline of the body. That's why it is called the eversion of the foot. Then the last term is protraction and retraction. First, protraction. It refers to the anterolateral movement of the scapula on the thoracic wall that allow the shoulder to move anteriorly. So when though the anterolateral movement of the scapula on the thoracic wall, it helps to the allow of the shoulder to move anteriorly. It is called the protraction or when the lower jaw slides forward in its sockets in the temporal bone of skull. It is also an example of protraction. You see that in the first image when the shoulder moves anteriorly, it is called the protraction, and in the second slide when the lower jaw moves forward, it is also an example of protraction. Then retraction, it refers to the posteromedial movement of the scapula on the thoracic wall that allow the shoulder region to move posteriorly. You see in this image that though the posterior lateral movement, the shoulder region moves posteriorly. This is an example of retraction. Or when the lower jaw slides backward in its socket in the temporal bone of skull. You see in this image that the lower jaw slides backward. So these two are the example of retraction. I think this video become more lengthy. So after completing the general plan of the body, I end this video. So our next point is the general plan of the body. First, sagittal plane. Second, mid-sagittal or the median plane. Third, coronal plane or the frontal plane. Fourth, transverse plane or horizontal plane. And fifth, oblique plane. So start with sagittal plane or longitudinal plane. A vertical plane that divides the body into right and left parts. That plane is called the sagittal plane. You see in this picture, this is an imaginary line that divides the body into right and left halves. Then the mid-sagittal plane or medial plane. It is a type of the sagittal plane that lies on the midline. So when the sagittal plane lies on the midline or the middle of the body, so the both halves are equal, it is called the mid-sagittal plane or the median plane. Then parasagittal plane. The parasagittal plane that divides the body into unequal right and left portion is called the parasagittal plane. So this is the body of a human being and this is the midline of the body. So if I cut the body from the midline of the body, so the right and left halves are equal. So it is called the mid-sagittal or the median plane. And in the parasagittal plane, when I cut the body with an imaginary line that is a parallel to the median line, but it can divide the body from unequal right and left halves. So that's why it is called the parasagittal plane. Then frontal plane or coronal plane, a vertical plane that divides the body into anterior and posterior parts. It is called the frontal or the cranial part. You see in this picture that there is an imaginary line that divides the body into anterior and the posterior parts. Then transverse or the horizontal plane or axial plane. It is also called the cross section, divides the body into superior and inferior parts. You see that this is the image of the transverse plane that divides the body from an superior and inferior parts. Where the superior means the upper parts of the body and the inferior means the lower parts of the body. So though the transverse plane, our body can divide two parts, superior and inferior. Then oblique plane. Oblique plane means that something is not parallel or a right angle. It is a plane that cuts the body diagonally, not parallel to the horizontal or the vertical angle. You see in this image that the oblique plane that helps to cut the body diagonally, which is not parallel to the horizontal or the vertical angle. So mainly those are the important plane of the body: sagittal plane, mid-sagittal plane, parasagittal plane, frontal or the coronal plane, transverse plane, horizontal plane, axial plane, oblique plane. So these are the main plane of the anatomy. I think I make a lot of video about anatomy where there is a lot of example, proper explanation, and there is a lot of image. If this video is helpful to you, please like, comment and subscribe my channel.